Opening a drug rehab in Pennsylvania means stepping into a crisis. In 2022, the state hit 43.2 overdose deaths per 100,000 residents, well above the national rate. Pennsylvania reported 43.2 drug overdose deaths per 100,000 residents in 2022, compared with the national rate of 32.4, according to methadone.org from NAMA Recovery. How to open a drug rehab in Pennsylvania. A step-by-step startup guide covering licensing, compliance, costs, and the systems you need to run it. We walk through the DDAP licensing path, the Pennsylvania code requirements, realistic startup costs, and the technology that ties it together. Pennsylvania's opioid epidemic remains one of its most pressing public health challenges, and that drives real demand for treatment. Over 293,000 Pennsylvania residents experience substance use disorders each year, with fentanyl contributing to the majority of overdose deaths. Many rural areas lack adequate addiction treatment facilities, so a new center can address service gaps while creating jobs. Pennsylvania's state code is highly specific about clinical, building, and program requirements. Miss them, and your license is on the line. Chapter 704 and Chapter 705 of the Pennsylvania Code cover staffing ratios and physical plant requirements for addiction treatment centers. On top of state rules, providers must comply with HIPAA and 42 CFR Part 2, which protects substance use disorder patient records. BehaveHealth.com offers billing solutions tailored to rehab centers with EHR, CRM, and RCM software designed to support compliant operations from day one. The guide calls for HIPAA-compliant software for billing, patient records, and telehealth, exactly what Behave Health is built to provide. EHR, CRM, and RCM solutions are designed to streamline operations and support the compliance demands of a Pennsylvania startup. Opening a rehab in Pennsylvania follows 8 steps, from market research to the systems that run the place. Let's walk through them. Each step builds on the last. Skip one and you risk delays, denials, or a compliance gap at inspection. Step 1. Analyze local addiction trends, service gaps, and competitor offerings. Use data from sources like DDAP's licensing reports and overdose surveillance dashboards to understand where demand is unmet. Step 2. Build a business plan that funders and regulators can take seriously. Include a mission statement, financial projections, marketing strategies, and facility design plans. Step 3. Secure the capital to open. Costs are not small. Startup estimates range from roughly $200,000 to $1 million, depending on facility size and services. Consult a financial advisor for your own projections. Explore federal SAMHSA grants, state-level grants through DDAP, and private investors or healthcare loans. Step 4. Pick a location that clears zoning and serves patients. Confirm the site meets local zoning laws and prioritize proximity to hospitals and pharmacies, plus public transportation access. Step 5. Get licensed. The DDAP oversees addiction treatment provider certification in Pennsylvania. Get DDAP certification for outpatient facilities and license residential programs under Chapter 705 of the Pennsylvania Code. Pursue accreditation from CARF or the Joint Commission to round out your credentials. Step 6. Staff up with the right credentials. Staffing should include licensed addiction counselors, medical professionals, and administrative personnel trained in HIPAA compliance. Step 7. Design a space that supports care and meets plant requirements. Create a safe environment with therapy rooms, group spaces, and recreational areas. Step 8. Stand up HIPAA-compliant systems before you open. Invest in HIPAA-compliant software for billing, patient records, and telehealth services so operations are compliant from the start. Before you open the doors, the guide's compliance checklist keeps your license safe. Register with DDAP, complete fire safety inspections, and submit zoning permits. Develop HIPAA-compliant policies and obtain CARF or Joint Commission accreditation. Conduct staff background checks and maintain updated training on legal requirements. Behave Health offers billing solutions tailored to rehab centers, so the systems your Pennsylvania startup needs are designed to support compliant operations. The EHR is designed to support HIPAA-compliant patient records, a core requirement in the startup checklist. CRM and RCM solutions are designed to streamline operations and the billing your new center depends on. Stop guessing at Pennsylvania's startup compliance. See the EHR, CRM, and RCM built for treatment centers at BehaveHealth.com Explore billing solutions tailored to rehab centers and book a 20-minute demo at behavehealth.com.